All right, today we're going on a bit of a journey deep inside the human body to tell the story of a single artery. And it's a really important story because it's about a silent process that can lead to one of the biggest health challenges anyone can face: coronary artery disease.
So why does this story matter so much? Well, you just need to know this one fact. Coronary artery disease isn't some rare, obscure condition. No, it's one of the main reasons people die all across the globe. It affects millions. So here's our roadmap for this explainer. It's really a story in 5 parts. First, we'll look at the hidden threat. Then, we'll get into the nitty-gritty of how an artery actually clogs up. After that, we'll talk about the warning signs, how doctors figure out what's wrong, and finally, the best part, how we can all fight back.
Okay, let's dive into part 1, the hidden threat. Here, we're just going to break down what this disease actually is, and just as importantly, who should be paying close attention. So, at its core, coronary artery disease, or CAD for short, is basically a plumbing problem. Simple as that. The pipes, or in this case the arteries that feed your heart muscle, they start to get narrow. Why? Because of a buildup of gunk called plaque. This whole process is called atherosclerosis. And when those pipes get too narrow, the heart can't get the oxygen-rich blood it desperately needs. That's when the real trouble starts. So, who's at risk here? Well, the factors really fall into 2 different camps. On the left, you've got what we call the non-modifiable risks. These are the things you're stuck with, right? Your age, your gender, your family history. You can't change them. But, and this is so important, look at the list on the right. These are the modifiable risk factors. Things like smoking, high blood pressure, what you eat. This is the crucial part. While some of it is out of our hands, so many of the most powerful risk factors are things we absolutely can control.
Okay, section 2, how an artery clogs. Now we're going to zoom in and look inside the artery itself to see exactly how this whole process unfolds, step by step. You could say this is the main event in our story. You know, a healthy artery has this beautifully smooth, flexible inner lining. But the whole problem, this whole process of atherosclerosis, it all kicks off when that delicate lining gets damaged. Just think of it like a tiny crack in a wall. It creates an opening, an invitation for trouble to get in and start building up. On this slide right here, this shows the whole chain of events. It starts with that damage we talked about, which lets the bad LDL cholesterol seep into the artery wall. Your body's immune system sees this and rushes to the scene, causing inflammation. These immune cells start gobbling up the cholesterol and turn into what are called foam cells. Next, these foam cells pile on top of each other, forming a little bump, the very first stage of plaque. Over time, a hard cap forms over it, and the plaque just keeps growing, making the artery narrower and narrower. But the real crisis, the life-threatening moment, is if that cap breaks open. Your body tries to heal the wound by forming a blood clot, and that clot can suddenly and completely block the entire artery. So for years, maybe even decades, that whole process can happen without you feeling a thing. It's completely silent. But eventually, the narrowing gets bad enough that your body starts sending out distress signals. And that brings us to section 3, from warning to crisis. The symptoms usually show up on a spectrum. First, you might get something called stable angina. This is predictable chest pain. Like every time you walk up a steep hill, you feel it, but as soon as you rest, it goes away. But then things can escalate to unstable angina. This is a huge red flag. Now the pain is unpredictable. It can happen even when you're just sitting on the couch. And the final crisis point is a myocardial infarction, what we all know is a heart attack. This is when a blockage is so severe that it's causing intense pain, shortness of breath. It's a sign that the heart muscle is literally being starved of oxygen. So, when those symptoms start to appear, it's time for an investigation. Section 4 is all about how doctors become detectives, using a whole bunch of tools to figure out exactly what's going on inside those critical coronary arteries. And doctors have a pretty impressive toolkit to work with. They can use an ECG to check the heart's electrical rhythm, or blood tests to look for specific proteins that leak out when the heart muscle is damaged. A stress test sees how your heart holds up under pressure. But the real gold standard, the definitive test, is something called a coronary angiography. This is where they inject a special dye and use X-rays to get a live video of your arteries. It shows them exactly where the blockages are and how bad they are. And now, for what I think is the most hopeful part of this whole story, Section 5, fighting back. Because finding out you have a blockage isn't the end, not at all. There are incredibly powerful and effective ways to manage this disease. And the fight starts right here.
The very first, and you could argue the most important line of defense, is all about lifestyle. These four things, quitting smoking, eating better, moving your body, and managing your weight, they are the foundation. They can slow this disease down, stop it in its tracks, and sometimes even reverse some of the damage. This is the part of the treatment where the power is truly in your hands. Now, on top of those lifestyle changes, there's a powerful medical arsenal. We're talking medications like aspirin to help prevent clots and statins to get that cholesterol down. And for really bad blockages, there are two main procedures. One is putting in a stent. It's like a tiny metal scaffold that props the artery open from the inside. The other, for more widespread disease, is bypass surgery, where surgeons literally create a new route for the blood to flow, bypassing the clogged up section completely.
So after this whole journey, from that first tiny crack in the artery wall all the way to bypass surgery, the entire story can really be boiled down to this one sentence. Plaque narrows the arteries, which starves the heart of blood and can lead to a heart attack. That's it. That's the core of this entire story, right there.
And that brings us to our final thought. We've seen the risks you can't control, but more importantly, we've seen all the powerful factors